The following interviews are patients of mine who didn't want to be identified. And so I'm going to be speaking with them over speakerphone. And we're going to be speaking about a variety of topics. So I hope you enjoy it. Thank you for coming on today. I appreciate it.
You're welcome.
Yeah, so if you could tell us what brought you in to see me and give us some details about that.
Yeah, depression and anxiety. I was suffering from depression, especially after my mother died a couple years ago. And, I thought, like a lot of people, I could manage it myself. And it just kind of became unbearable. And so, at the request of my girlfriend, I finally, went to see you, and you were highly recommended in a referral. So that's how we got to meet, and I was referred to you.
And if I remember right, I think, had you taken anything before you saw me at all?
Absolutely not. I'm not a kind of person that wants to take medication, so I was a little apprehensive. And, we all watch TV and know the side effects and hear them, and it just scares the heck out of you.
Right.
So, to be honest, I was very reluctant.
Yeah, and then that's very common. So thankfully, I was able to talk you into actually doing something for it. So if I recall, I think I started you on Wellbutrin, and we also started you on Effexor.
Correct.
And the Effexor, you didn't have it made you tired, it made you dizzy. So I stopped that, and then I put you on Lexapro. And even on 5 milligrams of that, you didn't feel well on that, right?
That's correct. Right.
So I think you're feeling sluggish, right? Tired?
Correct.
Yeah. So what I did then, I think I put you on Wellbutrin at that time. And by the second time I saw you, I had increased the Wellbutrin up to 300, and I think that really pulled you out of the depression, didn't it?
Absolutely. I mean, it was really like night and day. It really helped me feel better, and my anxiety and depression were really, really more manageable.
Right, and then I think I stopped the Lexapro because of the side effect, and then I gave you some samples of something called Rexulti. How is that going?
That's going well, doctor. I mean, that combination is like a 1-2 punch. Really, really helped me out quite a bit. And I think the science behind it is really trying to find the sweet spot as to how much you need or how little you need.
Exactly. And what dose of that are you on now?
So right now, I think my sweet spot after, several, trials and errors and you and I discussing it, 150 on the Wellbutrin, and then on the other one is really, I'm on the generic 5 milligrams. It's kind of my sweet spot. On the
Abilify, because I think what happened is that the Rexulti really was expensive, and I switched you to Abilify. Which is the closest, close, like first cousin to Rexulti, the same company that actually made both. So you're at a good place now. The depression's better, the anxiety's better.
Oh, absolutely.
Great.
Significant, and people around me are even noticing it. I'm not as snappy or angry, or it's just able to handle. One of the things that's significant for me is really able to handle stressful situations and not panicking and just kind of thinking through it. Sleep is getting better. Things that I didn't want to do or was reluctant to do, I'm starting to get more involved in, like exercise and reading and things of that nature, things that are good for me, So to me, those are life-changing things. And looking back, it was kind of like I told you this, I had my doubts, but, looking back, it's like I should have probably done this a long time ago.
Well, yeah, and I think a couple of things what you just said is important. I think number one, what you said is that these medications do not control you; they put you in control. And when you're in control, it changes everything. When your body is not, when you're feeling that when things around you happen that would make you angry before and don't make you angry now, that's because you're in control now. And the other thing you said is that you're doing more things that you used to do before. The things you used to enjoy. That's a really strong signal. We call that anhedonia, which is when people just lack they don't want to do things they used to enjoy doing, and when that happens, you pull out of get that better. That's a very significant sign. So this is just an example of just a couple visits, a couple medication changes, and look at your life now, and so that's why it's so important to understand what these medications are really all about. They're really there to restore a balance in your system. And the thing is, you couldn't help, and you also, I think you shared with me, you had a pretty difficult upbringing with your parents.
Correct. Yeah, that's correct.
Yeah. So all those things contribute, but I think now, the good thing is for you, you're never going to have to ever feel like that again. Going forward in your life, this is going to continue. And there's no reason to ever go back to that. So, might we tweak things here and there? Maybe, we'll see. But I think this is it's very, very, very possible that you're going to just stay on these two simple things, and that's it. So.
Well, that's great. Well, Doctor, I have nothing but great things to say about you, and I'm truly grateful for this medicine and for you helping me in your guidance. So thank you.
I appreciate it. Well, thank you so much for coming on. I appreciate you doing this.
My pleasure. Anytime,
right.
Doctor. You take care.
You too.
All right. Bye-bye.
So his case is kind of interesting. It's not what I've been doing this a long time. I often guess right the first time, but this time I didn't. So I saw he had the anxiety, he had the depression. So I often I go with my first line, which is a SNRI, which is, in his case, I chose Effexor. And because there was a cost issue because he didn't have insurance. And he didn't tolerate it well. So I thought, okay. And that's working on serotonin and norepinephrine. I said, okay, well, let's try SSRI, Lexapro, and most people have heard of that. And that one made him really tired and didn't help him. So what that did is it shows me that serotonin not an issue, norepinephrine not an issue. Well, let's try dopamine. So let's try Wellbutrin. So Wellbutrin basically is a dopamine, a little bit of norepinephrine, but mostly a dopamine reuptake inhibitor. So it basically attaches to dopamine, and then it blocks it from going backwards, and it makes it go forward and connect to the next cell. And remember, these cells are constantly connecting around the system on 1,000 times around the body a second, so very rapidly. But then it was helping, and he was still having problem with anger and irritability and anxiety, and so I thought, with him there might be a bipolar component. So when I gave him samples of Rexulti, I was testing it out, and sure enough, he responded to it. So what that is a dopamine antagonist. So Wellbutrin's helping it go forward, and basically Rexulti kind of slows it down. So you got one pushing it forward, one slowing it down. So it creates this perfect balance. So and with Wellbutrin, in his case, it was 150 milligram, which is half the average dose, and that's not uncommon when there's a bipolar component. That the antidepressant dose is lower than the average of 300 usually with Wellbutrin. So a little bit of Wellbutrin, and also I switched Rexulti to Abilify because it's a lot cheaper when you don't have insurance, and then Abilify slows it down. So now he has a perfect balance of dopamine, and he's doing great. And I expect he's going to remain that way as long as he keeps on them. And as far as how long he'll keep on them for, it's unclear at this point, but who cares at this point? At least a year, and then we'll talk about it then. But that's a really important case of somebody who 2 visits, and he's significantly better, and someone who was very reluctant to come in to begin with, and now he's very happy that he did. So that's a great result.
Hey, Doc, how you doing?
Good. How are you doing? Thanks.
Good. We're in the car on our way to a wedding.
Oh, on the way to a wedding. Great. Awesome. Yeah, I like going to weddings. I really do. My son's getting married in September, so.
Oh my gosh, that's crazy.
Yeah, it's
wow.
Yep, we're getting closer and closer to being grandparents. So my wife cannot wait to be a grandmother. So,
yeah. Oh, that's awesome.
So if you,
I was a little worried if I would be okay, but after talking to you, I feel back to myself again. So thank you so much for being so amazing and always being there for me and my family.
So tell us, because of the recent thing that happened.
Okay, yeah. So it was so bizarre because usually you think of like panic attacks or anxiety is actually being in the moment and being nervous about something. But for me, I feel like it was delayed, like a delayed response, because I had gone through a lot of stressful things lately. You know, we had a change of lenders, and we had, some issues and personal funds issues and stuff, and deal with it. And I felt like in the moment I was in survivor mode. And then randomly I was shopping for my daughter in the store, and out of the blue, I just started having a massive panic attack. And it was like I was sweating, and I just felt like, oh my gosh, I'm having a heart attack. And it was just so weird because at that moment when I was having it, everything was fine. Like there was no reason for me to be anxious about anything.
And what I gave you, did that help?
Yes, absolutely. I mean, use the breathing. You told me to breathe, and it's so true. It's like sometimes we forget in that moment to breathe, and it resets. Like you were telling me, it resets. But I have to thank you for teaching me and telling me that there is such a thing as delayed anxiety, which is so crazy. I think it should be talked about more. Like women my age, we don't realize that sometimes when we're a mom, we're stuck in survivor mode. We're like, okay, we get whatever's thrown at us, we'll deal with it. And then if we don't deal with it at that time, if we're in survivor mode, it comes out later when, like you said, when we feel safe.
Right.
Things are calm.
Right. And that's a lot of people don't get that. They like you said, I'm at the store, I'm doing this, there's nothing around me that should be causing me anxiety. Why is it coming out now? And I explain to people it often doesn't happen when you're like at work, busy, doing something, because your brain is on work mode and you're busy and doing things, and so you don't have time to have anxiety. When it happens is when you're resting or when you're somewhere peaceful. Like a lot of people say, it happened when I got home in the evening, and I know the stresses for my work. I hate my boss, or this or that, or my coworkers, or whatever, and that's where my work is my source of stress. My home is my safe space. It's my place I can relax. Why is this happening when I get home in the evening? Why is this happening when I'm trying to wind down at night and trying to watch a little bit of TV to relax? See, people try to figure it out because what's going on is you're trying to relax, but inside all that emotion, that stress is able to come out now because your body is in kind of a rest mode, and that's when the anxiety can kind of take advantage and then strike, And so I tell people, like I did with you, I mean, number one, focus on your breathing. So stop, don't hyperventilate, slow down. And I tell people to take a deep breath in, hold your breath for a second or two, and then all the way out slowly, and hold your breath in a second or two there. And then I tell people just slow down the breathing, deepen the breathing, keep doing it over and over again. If you can do it, go out, take a walk around the block, or go walk outside because it get some fresh air. That can help. And sometimes I'll give some people a little bit of a minor tranquilizer, a little bit of Xanax or Klonopin or Ativan or something like that. That can be very helpful at the moment also. Can you talk about me? I mean, you and your husband have been patients of mine for, I don't know, how many years has it been?
How many years have what?
I've been his patient, like 12 years.
Doc, I remember you when I was like 10 years old.
Are you serious?
Yeah. I mean, I remember my parents liked you because you graduated from USC.
Go Trojans.
Yeah.
Go Trojans, yes. I'm if you look at my wall at my office here, it's all USC paraphernalia, football pictures. All our Christmas cards are all USC themed, and so I'm a diehard Trojan. I remember your mom, and I remember back in my old office when I was doing family practice, I was seeing her, and I think I saw you when you were a girl. When did you first start to develop any anxiety? Like about what age do you think you were?
To be honest with you, I kind of felt it growing up because I did a lot of performing and stuff, and I never really understood what it was. but I had a really bad night one night. I was either at a party in Hollywood and I had a drink and I think somebody slipped something in my drink. And it was a really bad experience. And that was when it kind of started. And I think it's just basically when you have a brush of death, I guess, it's almost like you don't feel safe anymore.
How old were you when that happened?
I think I was about 21 when it happened, 22.
Yeah.
Yeah. And absolutely. I just kind of couldn't put into words what it was when I was feeling it.
Yeah.
It's definitely anxiety. It's like, you described it perfect. It's like you feel like your security blanket is gone, you know, and you go to the emergency room because you're thinking you're having a heart attack when it's not, you know, it's just, you're just having anxiety. But I have to tell you though, I love talking to you because you definitely, as a person like me, we have to be in control. We have to know what's happening.
Right.
We have to know like what's actually, you know, like, okay, so this is why, you know, A plus B equals C. And for me, talking to you, you describe it in such a way that when it does happen to me, when I do feel anxiety coming on, I'm like, okay, this is anxiety. I know what this is. You know what I mean? Like when you said it's delayed anxiety and you explained it to me, I felt so much better already because it was like, oh, okay, so that's what it is. And I think a lot of people who have anxiety like me and stuff, we just kind of need to know why.
Exactly. Well, because you're a logical person, you need to, you know, and you need, if you don't know, then it just makes anxiety worse because you want to be in control. We all want to be in control. We don't want, but the thing about anxiety, it controls us when it happens, and nobody wants that feeling. And a lot of people, like you mentioned, the ER. Probably half of the ER visits are for anxiety attacks because people think they're going to stop breathing. They're having a heart attack. I think I have brain cancer because I have a headache. But so people start panicking and then they end up in the ER and then they're sent home. They're reassured, go see your doctor. And a lot of doctors will just say, here, take some Xanax and go home and you're fine. I don't do that with patients because I know that you have to, if it happens, it's going to happen again. If it gets to that level where you're in the ER, it's not just a simple anxiety. It's more of and again, when I take a history from someone, I can tell that there's more going on. And in your case, you had an element of PTSD because of your experience being drugged, and the same thing with people who are victims of crime. Well, that is a crime right there. Victims of crime, they develop this where they don't feel safe anymore, and or people have near death, like you said, near death experiences. It really dramatically affects them. And so, when did I first start treating you with medication? Was it how many years ago was that about?
You first started me on medication. I think it was around that time, like right after it pretty much happened. You said exactly, you know, you need to stop going to the emergency room because I was going like 4 or 5 times. Remember, I was just like, something's wrong. I'm having a heart attack. And you were like, Lexi, it's in your head, knock it off. Here, you got me started on Effexor and Wellbutrin and basically gave me my life back, you know, and I'm so grateful.
Years ago.
Yeah, so about 20 years ago.
Yeah.
And, you know, I mean, it was such bad anxiety, I couldn't even drive by myself, you know? So, yeah, you know, I just, it's comforting to know that there's other people out there that feel the same way as I do. Like when things happen, when you don't feel in control and you have a traumatic experience that happens. But I saw a funny meme or quote the other day that said like, oh man, you know, when something happens and you're like, oh man, I'm going to have a major anxiety attack about this in about 2 weeks.
Yep. That's about right.
And it's like, oh my gosh, that's so true. That's so true. And I absolutely love that it's not really been a stigma anymore. It's almost like, oh, hey, you know, I take this or you take this and stuff. And it's just so grateful because I remember my mom having severe anxiety. Right. And it wasn't really known back then.
It wasn't. And that brings up a point of genetics. You got it from mom. And I think, well, I mean, I knew your dad too before he passed. And I think did he deal with it too? I can't remember exactly.
You know what's so funny is both of my parents had it, but they both showed it in different ways.
Right.
It was so interesting. Yeah. I mean, my mom was more verbal about it. My dad would just get quiet and go to his room. And, you know?
Yeah.
Very, very different. Yeah.
Yeah, I miss that.
I kind of feel like it happens like in your 20s. It comes out in your 20s, I think.
I miss your parents, so I'm sure you do too.
I do every day.
But
every day. And you know what a riot they were. They were pretty awesome people. And
yeah, they were.
I love that you knew them, and they loved you very much. Too.
Yeah.
So you gave them extra years. You know, so I will always be grateful for your doctor.
And for you too. I mean, you're on these baby doses, so you're on doses that most doctors think are not going to work, because most doctors think, oh, Effexor, you got to get up to at least 150 to, no, you're at 37.5. You're at the lowest dose, and on Wellbutrin, you're at 150. You're at the lowest dose of that. So. But the whole point is you have to individualize the treatment. You can't just push things when someone doesn't need it. And it was very clear early on with you that you responded so quickly that we didn't need to do. I think I tried going up and it was too much. We backed it down, and that's why you've been staying at this same tiny doses of both of these. I call the dynamic duo. Effexor Wellbutrin is one of the dynamic duos of medications, because they work so well together. So anyway.
Absolutely. And when you have people like me, I'm very, very hypersensitive with my body.
Yeah.
I knew I was pregnant, like the day I was pregnant, I'm so sensitive. I knew exactly when I got COVID. I was like, oh, I'm feeling it. I'm so sensitive with my body. I can feel things happening with my body. So the 37.5, I can actually feel it kick in. It's just so bizarre. Of course, maybe most of it is mental, but it's absolutely perfect for me. It's just a little bit, and it works. So I'm on my way right now to a wedding with my husband, and I'm just not having any anxiety, and we're looking forward to having a good night. Yeah,
when you say it's mental, well, it is mental because it's your brain. So so the brain is what's going on here. It's balancing your brain, and so when people say it's mental, they're absolutely right. Or when people say it's all in my head, it is in your head. That's where your brain is. So it's been a pleasure working with you and your husband. You guys are great people, and we're going to continue working with each other for many more years to come, I know. And but thank you. I really appreciate you coming on, and I know you're off to a wedding, so I don't want to hold you up any longer. So
yeah, we love you, Doc. Thank you so much.
All right, you take care.
Bye-bye.
All right. So with her case, again, very common with anxiety disorders. The ER visits, extremely common. So in her case, I started with Effexor. This is 20 years ago or so when I started on. So this is before Prestige came out. But Effexor, again, a serotonin, norepinephrine reuptake inhibitor, SNRI. Number one thing I prescribe in my practice Effexor used to be the one I prescribed the most, and then Prestige is now, but they're very, very similar. You can switch from one to the other pretty quickly and easily. So we got Sarah. So what I did with her, I didn't start her on the Wellbutrin. I gave her Prestige, serotonin, norepinephrine. Boom, her anxiety gone, out of control. But if we keep on just that, what can happen is fatigue, sometimes lack of motivation, energy. Wellbutrin and DRI, working on norepinephrine and dopamine. Now we got dopamine going, and boom, and that's it. With her, a very simple case. And again, the other thing with her is that she's on like half of the average doses. Again, most doctors have this notion that you have to push the dose up. When Effexor first came out, it comes in at 75, it comes in at 150, and the maximum dose is 300 milligram. And so I do have some patients at those higher doses. Most people are, number one, and most average dose I've found is 75 actually. But the second most common dose is probably 37.5 or 150. But this notion that we have to push everything up, I think this is probably why most doctors don't understand this. I think when Effexor came out, I think doctors listened to that. And I think it got the nickname side Effexor at the beginning, because I think doctors were following what the company was saying, you have to push it. And I was starting to see, wait a minute now, something's not right here, because people are responding very quickly to it. So I started seeing sometimes the first days or the first week, it was working well. And then we went to the second one, 75. Okay, a lot of people that works a lot better, but not in her case. So I think with her and with most of my patients, you have to individualize treatment. You can't go by what companies say. You can't, I usually start most people on at least maybe half the dose that the company recommends starting. I do that with most medications because there's no rush, and we want to find the individual dose. And if we try to rush things, and we're going to scare people off with side effects, and then they may end up stopping it. They may not come back to see us again. So there's no rush. In her case, it was 2 simple steps. Her life changed on them 20 years later. Again, she had the genetics from both parents. She's got the situational stress of being drugged when she was 21. That contributed, and now she's a mother of 2. She's a teacher. She's doing really, really well, and she's a pleasure to work with. I hope you enjoyed the show today. If you have issues with mental health, or if you know someone who needs help, I'm available. If you want to contact my office, my website is drpaulcoronamd.com. That's DR for doctor. And you can also learn more about me on my website. My phone number, if you want to contact my office directly, is 949-481-0118. If you want to learn more about my methods and what I do, my latest book, I recommend The Corona Protocol, a scientifically proven medical solution to stop addiction, bullying, homelessness, school shootings, and suicide, 30 years in the making. In this book, I tell 30 original short stories about people. And I also have my first 3 books, Healing the Mind and Body, the trilogy, available online. I look forward to you joining me again on the next episode of The Dr. Paul Show.